Hi, and welcome back to my channel. On this channel, we talk about everything books, nursing, medicine, and of course, university related. Now, today we are going to talk about the nursing process. Nursing process is another nursing topic, and it's an important topic because without the nursing process, there can be no nursing. So, the background of the nursing process is that it was first described as a four-stage process by someone called Ida Jean Orlando, and that was all the way back in 1958. Now, Ida Jean Orlando started the nursing process. It as a way to guide nurses on how to give care to their patients. So she described it as a systematic approach to care, and it's consisted of fundamental principles of critical thinking, patient-centered care, and how to be goal-orientated when we are carrying out our day-to-day nursing task. But another thing that she asked is that this sort of nursing should be evidence-based practice only. And, it was implemented by many nursing institutions, and since 1958, we have been using it. And it's proved to be a holistic way of doing nursing, and it helps with scientific principles as well, and just really helps nurses to implement compassion and quality of care when they are offering care to their patients. So it's a really good process that all nurses should understand and follow. Now, it has four real elements. The first element is assessment. Assessment is the first step, and it really involves things like critical thinking skills, data collection skills. So when you think of your data, you're thinking of subjective data and objective data retrieval. Now, subjective data usually involves things like spoken things, verbal statements from patients or from their caregivers. Objective data is usually data that is measurable, tangible, such as your vital signs, your input and output, height, weight, that sort of thing. Data is very important. Data collection or assessment is very important because it comes from the patient directly, or it comes from their primary caregiver who understands the patient and knows the patient. And these people might be better able to give us information that the patient is not able to give. And these people are usually, not always, but usually family members, close family members. But also it could be a friend, it could also be a neighbor who is in the role of a caregiver. We can also get data from places like electronic records, or GP records. We can get data from that, and we can get data from our medical notes on the wards as well. Now, critical thinking is essential in assessment because without critical thinking, we cannot give an idea of how to base the concept of the things that we've learned about the patient and how to implement strategy and changes based on the things that we've learned about our patients. There's another bit of the nursing process that we tend not to use unless we are in the role of an advanced nurse practitioner, and this is diagnosis. So diagnosis is only done if you're an advanced nurse practitioner, but it's good to get an idea of how it works. So diagnosing a patient is a way of formulating the ideas that you got from your assessment using your clinical judgment, and this clinical judgment will then assess you with planning and implementing care to the patient. So nursing diagnosis really encompass a nurse using higher order thinking, critical thinking again, but higher order thinking. So we're thinking things like Maslow's hierarchy of needs, which helps you to prioritize the care that you've planned based on person or patient-centered outcomes. And these are basic psychological needs such as safety and security, love and belonging, self-esteem, and self-actualization. Really important when we are thinking about diagnosing our patients and offering care to our patients. We might get patients who are suicidal, who are at risk of falls, different areas that might need to be diagnosed and treated in that way. But at this step and at this stage in our nursing career, we do not diagnose. We diagnose when we become advanced nurse practitioners. And in diagnosing, it really helps to empower a nurse. And I'm hoping that many of my students will go on to become advanced nurse practitioners and use the skill of diagnosing. So let's get back to the process, the part of the process that you will use in your everyday practice. So from assessment, so you've assessed the patient, you found out the patient's need, you've gotten your objective and subjective data, and now you've got all the data that you've collected, and you're going to use this data to plan care for your patients. So your goals should be specific, measurable, attainable, realistic, timely, and of course, once again, critical thinking is important. So I've listed there that you really need to have a SMART goal. So the planning stage is where the goals and outcomes are formulated that will directly impact the patient's care, and this impact need to be within your guidelines and your protocols. Never do things or plan care that falls outside guidelines and protocols. Now, these patient-specific goals, so the goals that you've planned for patient in bed 5 cannot be the goals that you've planned for patients in bed 4. They must be specific to that patient, regardless if the patients have been admitted for the same diseases or you're treating the patient for the same diseases. So these patient-specific goals should be attained with areas such as, assisting the patient to get positive outcomes. If the outcomes are not positive, then they should never be planned. So nursing care plan are essential. So this is where your care planning comes in, and you're going to use goal setting to implement your care plans. So care plans should provide a course of direction. So this is the direction that we're taking the patient into based on that patient's personalized care plan. The individual needs must always be met when you are planning your care for the patient. So the overall condition, the comorbidity plays a role in how you structure your care, because you are always trying to help your patients to live their optimum life. So your planning or your care plan will enhance things like communication, documentation, reimbursement, and continue care across the lifespan. Do think SMART goals when you are planning your care. And once again, SMART means measurable and meaningful, attainable or action orientated, realistic or results orientated, timely or time orientated. And those are your SMART goals. So let's move on. You've assessed the patient, and based on the assessment, you've planned care for this patient. Now we are going to implement the care that's been planned. In the implementation step, this involves action. So it's doing. So I've planned this care for you, and now I'm going to implement this care. So it's doing. Action. So you're going to carry out this care, whatever your nursing interventions might have been, you outline it in this bit of your care plan. Now, this phase requires nursing interventions such as applying a coordinate monitor to the patient, giving oxygen, doing direct patient care, administrating medication, following standards and protocols that are national or local policies. So you're looking at hospital protocols and policies, or you're looking at NICE guidelines, and this is how you'll implement your care. Then we get to the evaluation stage of this care. This final step in the nursing process is vital. Without evaluation, you will not know if the care is actually working, if you've implemented the care and it's working. So this final step of the nursing process is vital to positive patient outcome. So wherever a healthcare provider intervenes or implements care, they must reassess. So you are going to reassess or reevaluate or evaluate to ensure that this patient is getting the desired outcome that will benefit them. So reassessment may frequently be needed. So your evaluation stage might be revisited many times, and this will depend on the overall needs that has been assessed for that patient and the patient's condition, of course. So you will plan care. It might be adapted, might be changed, it might be a new assessment that's needed. It could be anything, and this is why the evaluation process is very, very important. Now, to wrap up that nursing process, we will think about critical thinking. Now, nursing clinical instructors understand that students need to become critical thinkers. So student faces difficulties if they're unable to make decisions that's related to clinical practice. Now, the main critical thinking skills in which nursing students should try and exercise during their studies are critical analysis, introductory and concluding justification. So you're going to analyze things, you're going to justify them, you're going to come up with a valid conclusion of why your justification is important, and then you are going to distinguish between facts and opinions. So is this fact or is it my opinion? So evaluation of the credibility of the information and the sources. So when you get or gather your information and your sources, are they credible? Always ask yourself, are these credible sources? Then you are going to clarify the concepts that you wish to use. Not only will you clarify the concepts, but you will recognize the conditions of which you are going to talk about, or of which you are treating, or of which you're assessing, planning, implementing, and evaluating care for. So let's go back over that quickly. Critical thinking is defined as a mental process of actively and skillfully perception, analyze, synthesis, and evaluation of the information that you have collected. So I hope that really helps. Remember that when you're implementing the nursing process, critical thinking is very, very important. Without critical thinking, you're unable to implement the nursing process. Thanks for watching, and don't forget to like, share, and subscribe. And I hope this really, really helps you in your decision-making process, in your evaluating process. So it helps to take you through the nursing process and help you to become and develop into the type of nurse that we all want you to be.